Hello. There's another issue that isn't mentioned much about in these doctors' videos, is releasing the tongue tie by cutting it. These are cases that sometimes come, though not very often. Usually the child is brought in an infancy with 1 year old, 2 years old, or he has just begun to speak. He can make sounds with difficulty. He cannot get the words out. In these patients, if the cause is the short tongue tie, it can be understood by examining the ligament under the tongue. The tongue cannot move freely. The tongue must touch the palate to be able to form some sounds. It must have that much freedom. If the tongue tie is too short, it's difficult to speak. What should be done? The tongue tie must be cut. But cutting alone isn't enough. We speak of it under the title of cutting the tongue tie, but what we are actually doing is cutting and lengthening it. There are different types of cuts and stitching methods. These are surgical techniques. When we do this, the tongue is stretched. The patient can use the tongue more easily this way. It acquires the ability to touch the palate. The operation does not take too long. It's about 10 to 15 minutes. There's just one more important thing here. When you cut the tongue tie, you have to be careful of the sublingual nerves. You shouldn't go too deep. You should immediately cut the mucosa, cut the tissue under the mucosa, and relax the tongue. Also, when stitching it, the issue in this area should be stretched. For if you cut the tie and stitch it normally, it will be short. You should stitch it by stretching it. Since the patients are babies, we leave them in hospital at night. In fact, there's not much bleeding in this area. Theoretically, there's a fear that there may be swelling of the tongue, but I have never experienced anything like that. Nevertheless, we put the patient in the hospital overnight to follow the rules. For like 1 day, we don't give the child anything too solid to eat. Soft things are given and the patient is dismissed on the next day. The stitches don't need to be removed as they dissolve by themselves. They melt and fall off within time. If the patient is of a cooperative age, say about 10 to 12 years old, if the patient's tongue tie is short and his speech has developed poorly up to his age, then speech will not improve immediately. To help this, it is imperative to send him to speech therapy. Cut the tongue tie, lengthen the tongue tie, and the tongue relaxes. But the patient should learn to use this relaxed tongue. You really need to send them to a speech therapist for that. This is the difference between infants and older patients. Actually, there is not too much detail. There is written information on the website. Still, if you have something in mind, you can ask me by email or phone. If you want to ask questions about these topics, I have all the contact information on my website. At the end of the video, you can find my email address and WhatsApp numbers. You can ask questions there. If your question is a visual problem, please send me a photo of the problematic area. If I can see it, I can answer it better. Also, be patient because there are too many messages. I try to answer them all one by one. Sometimes it can take up to a week, so I kindly ask you to be patient.